So far, most studies of the relationship between exercise and reductions in anxiety and depression have been correlational, and exercise appears to be associated with positive changes in mood states and reductions in anxiety and depression. So let's examine ways that we can better understand exercise and psychological well-being. Most research on the acute effects of exercise has focused on the reduction of state anxiety. But earlier studies have shown that aerobic exercise resulted in lowered state anxiety and higher tranquility scores. Later research also revealed that aerobic exercise was related to increases in positive engagement and revitalization. Depression is a well-documented source of human suffering, and about 1 in 4 Americans suffers from clinical depression at any given time. Physical inactivity has been shown to be related to higher levels of depression. Consistent agreement appears among other studies about the moderate relationship between exercise and depression. The relationships between exercise and depression are correlational. Exercise is associated with, but does not cause, changes in depression. Mood is generally defined as a state of emotional or affective arousal of varying and permanent duration. Certain types of exercise with certain levels of intensity, duration, and frequency are most likely to produce positive mood changes. Evidence also suggests a positive relationship between exercise and psychological well-being. However, no one theory or hypothesis has support as the sole or primary mechanism producing these positive changes. In addition to examining the relationships among exercise and anxiety, as well as depression and mood, researchers have asked whether exercise can change personality and mental functioning. Studies using clinical populations have shown positive changes in various aspects of personality adjustment, and regular exercise has been shown to be related to increased self-esteem. Hardiness is a personality style that enables a person to withstand or cope with stressful situations, a lot like resilience, and exercise can help protect against stress-related illnesses, especially for hardy people. Statistical reviews of more than 100 studies have shown that exercise has a modest, positive relationship with improved cognitive functioning. Physically active individuals tend to be in better health, report more stamina, and have more positive attitudes. Exercise, therefore, for the most part, is linked to a variety of indexes that all relate to quality of life. These include the following: increased levels of self-esteem, increased levels of enjoyment, increased self-confidence, and elevated mood states. Many regular exercisers report feeling better psychologically, emotionally, and spiritually after exercising. This phenomenon is so pervasive among runners that it has been termed the runner's high. To characterize the runner's high would be to define a euphoric sensation experienced during running, usually unexpected, in which the runner feels a heightened sense of well-being and an enhanced appreciation of nature and a transcendence of time and space. The use of physical interventions, including some form of exercise, has received increased attention since the late 70s, and many physicians and mental health professionals now routinely recommend exercise for their patients. Exercise benefits for mental health and psychological well-being are only more recently being discovered, and there appears to be ample evidence supporting the use of exercise to improve psychological well-being in clinical and other special populations. Despite benefits shown, exercise should not be used in all cases of depression, stress, or other emotional disorders. For example, aerobic exercise therapy should not be prescribed for people who are obese or for those with severe heart disease or high blood pressure that cannot be controlled by medication. Therefore, coaches have to exercise special care when supporting individuals to incorporate exercise as part of their therapy. You may already have a background in health sciences or exercise sciences and understand the benefits of physical activity. For those who do not see the relationship, let's define it by understanding that the first problem that exercise leaders face, as well as other health professionals, is to get people to move and to start exercising. People are motivated for different reasons. A good place to start is to emphasize diverse benefits that are seen with exercise. Regular exercise not only improves weight control and appearance, but also eliminates physical inactivity as a risk factor. Some theoretical models help us understand the process of exercise adoption and adherence. The first one is the health belief model, and it's the most enduring theoretical model associated with preventative behaviors. and it stipulates that the likelihood of an individual's engaging in preventative health behaviors depends on the person's perception of the severity of the potential illness, as well as his or her own appraisal of the cost and benefits of taking action. The theory of planned behavior is an extension of the theory of reasoned action and states that intentions are the best predictors of actual behavior. Some of these theories help us understand the process of adopting and later maintaining exercise habits and give us a way to study the process. The determinants fall into the following categories: personal factors and environmental factors. We can distinguish 3 different types of personal characteristics that may influence exercise adherence. People with higher incomes, more education, and higher occupational status are more likely to be physically active, so the first variable is demographically based. Of the cognitive variables, self-efficacy and self-motivation have been found to be the most consistent predictors of physical activity. Environmental factors can help or hinder regular participation in physical activity. Exercise interventions can be those that are school-based or even involve physical activity environments in the workplace, at healthcare facilities, or even at home. Exercise leaders influence the success of an exercise program, so they should be knowledgeable about physical activity, provide a lot of feedback and praise, and help participants set flexible goals and show concern for safety and psychological comfort. A coach should use prompts to initiate physical activity behaviors. Prompts can be verbal or physical or even symbolic. Reinforcement is a powerful determinant of future action. Some reinforcements include rewarding attendance and participation. Researchers compared 4 methods and found that program attendance was better when participants either received reimbursement based on attendance or incentives and reinforcement provided through programs to encourage them to adhere to a program for a longer period of time. Feedback is another important form of reinforcement. Providing feedback to participants on their progress can have motivational benefits. The more individualized feedback is, the more likely it is to succeed for the exerciser. Cognitive behavioral approaches assume that internal events have an important role in behavior change. Therefore, we turn to goal setting because it can be a useful motivational technique and strategy to improve exercise behavior and adherence. Exercise-related goals should be self-set rather than instructor or leader set, flexible rather than fixed, and time-based rather than distance-based. Thoughts or cognitions during exercising are also important to adherence to an exercise program. Internal body feedback is called association, and when focus is on the external environment, it is called dissociation. But we know the most lasting motivation comes from within. Studies show most people never really have changed their lifestyle in a way that could make exercise fun and enjoyable so that they would stick with it for a lifetime. Therefore, a coach should try to focus on the experience itself as well as on the process. In summary, it is believed to become lifelong exercisers, individuals need to make the shift from being more outcome-oriented to being more process-oriented. 6 types of approaches are useful to increase exercise adherence, and some have been mentioned before, but to summarize, they would include behavior modification, reinforcements, a cognitive behavioral approach, decision-making, social support, and intrinsic approaches. When a coach is mindful of all of these factors, exercise behavior and adherence becomes less problematic. It has been estimated that more than 25 million people are injured in sport, exercise, or recreational activities in the United States alone each year. Furthermore, people with high levels of stress have more sport and exercise-related injuries than people with less stress in their lives. Physical factors are the primary cause, but psychological factors can also contribute to injuries. Recent evidence also shows that psychological factors play a key role in injury rehabilitation. Coaches should understand both the psychological reactions to injuries and the ways in which mental strategies can facilitate recovery. A situation perceived as threatening increases state anxiety, which causes changes in focus and attention and also results in muscular tension. This, in turn, can lead to an increased chance of injury. Physical factors such as muscular imbalances, high-speed collisions, overtraining, as well as fatigue are the primary causes of exercise and sports injuries. But personality traits were among the first psychological factors to be associated with injuries. And most of the research on personality and injury has suffered from inconsistency and the problems that have plagued sport personality research in general or overall. Stress levels have been identified as an important antecedent of athletic injuries. Evidence, again, suggests that athletes with higher levels of stress experience more injuries than those with less stress in their lives overall. Therefore, coaches and fitness professionals should be aware of changes and stressors in their athletes' or individual clients' lives. Once a coach or fitness professional has determined that stress is present in the life of their client, teaching stress management techniques may help reduce their risk of injury and illness. Understanding why athletes who experience high stress are more prone to injury can help a coach to design effective sports medicine programs to deal with stress reactions and injury prevention. Sport psychology specialists, as well as athletic trainers, have identified various psychological reactions to injuries. Exercisers and athletes alike who have become injured often follow the 5-stage grief response process. Denial, anger, bargaining, depression, and acceptance and reorganization are the 5 components of this response. But athletes can also experience additional reactions to injury, including identity loss and fear or anxiety. Psychological techniques facilitate the injury recovery process, and fitness professionals and coaches increasingly use a holistic approach to healing both the mind and body. Recent studies have shown that psychological interventions positively influenced athletic injury recovery. And using relaxation and imagery during rehabilitation was beneficial both physically and psychologically in some published studies. Therefore, the research makes it clear that psychological factors play an important role in injury recovery, and injury treatment should include psychological techniques to enhance healing and recovery. For complete recovery, both physical and psychological aspects of injury rehabilitation must be considered by the coach or fitness professional. Highly motivated athletes are people who tend to overdo or overachieve, and recovering athletes should not exceed their program just because they feel better on a given day. Prepare the injured person for coping with setbacks during the recovery process as well. As a coach, be aware that psychological skills training has been shown to facilitate the rehabilitation process. Therefore, the role of the coach is vital to helping injured athletes recover and get back to 100% within their sport or physical activity environment. Addictive and unhealthy behaviors certainly are not limited to just elite athletes, as now we see even high school and youth sport participants abusing drugs, steroids, alcohol, and smokeless tobacco. Professionals in physical education, sport, or any sort of physical activity environment must be prepared to deal with these particular issues. Substance abuse, eating disorders, and even compulsive gambling are clinical problems requiring treatment by specialists. Anorexia nervosa and bulimia are the 2 most common eating disorders seen among athletes. Anorexia is potentially fatal. This is a multidimensional disorder with psychological, cognitive, perceptual, and biological factors interacting in varying combinations to produce slightly different types of disorders. On the other hand, bulimia is an episodic eating pattern of uncontrollable binging followed by purging. It is characterized by an awareness that the pattern is abnormal, fear of being unable to stop eating voluntarily, depressed mood, and self-depreciation. Consider that approximately 63% of all female athletes develop symptoms of an eating disorder somewhere between the 9th and 12th grade. Regarding substance abuse, despite dire warnings about the negative psychological and physiological effects of steroids and other performance-enhancing drugs, their use appears to be on the upswing. The misuse of drugs and the use of illegal and harmful drugs are the real problems seen in sport and exercise settings currently. Now, drug addiction is a state in which either discontinuing or continuing the use of a drug creates an overwhelming desire, need, and craving for more of the substance. Being able to recognize substance abuse in athletes is very important for coaches, but the list is large. Within the realm of addictive and unhealthy behaviors, we must consider exercise addiction, and this is a psychological or physiological dependence on regular regimens of exercise characterized by withdrawal symptoms after 24 to 36 hours without any exercise. Positive addictions to physical activity promote psychological strength and increased life satisfaction. In positive addictions to exercise, the variety of psychological and physiological benefits just referred to will typically occur as a person continues to participate in physical activity. For a small percentage of people, exercise can become a controlling factor in their lives. When this occurs, the person is said to have a negative addiction to exercise and eliminates other choices in life. Lives become structured around exercise for those who have a negative addiction to physical activity. When an addicted exerciser cannot exercise, the exerciser will probably suffer withdrawal symptoms including tension, restlessness, irritability, depression, interpersonal problems, and feelings of guilt. Overtraining refers to a short cycle of training during which athletes expose themselves to excessive training loads. Through physical activity, the process of overloading one's body can result in either positive adaptations and improved performance, or maladaptation and decreased performance. One athlete's perception of overtraining might be another athlete's optimal training regimen. On the other hand, burnout is an exhaustive psychophysiological response exhibited as a result of frequent, sometimes extreme, and generally ineffective efforts to meet excessive training and competitive demands. Some of the characteristics of burnout include exhaustion, which is both physical and emotional, or feelings of low personal accomplishment, low self-esteem, failure, and depression, and lastly, depersonalization and devaluation. To assess or see symptoms of overtraining and burnout, understand that overtraining and burnout are physical and physiological in nature. Some common symptoms include physical fatigue, mental exhaustion, grouchiness, depression, apathy, and sleep disturbances. Now, studies have examined burnout not only in athletes, but in athletic trainers, officials, and even coaches. Few people are aware of the long hours that trainers put in before and after games, or even during practice, and coaches pressure trainers to prepare athletes for game day, which adds more stress to them. Trainers with type A personalities are more likely to burn out than their type B counterparts. Coaches are prime candidates for burnout too. The wide variety of stressors that coaches report include the pressure to win, administrative and parental indifference or interference, disciplinary problems, the need to fulfill multiple roles, extensive travel commitments, and intense personal involvement. Studies have indicated that younger and less experienced coaches might have higher levels of perceived burnout. Older, more experienced coaches do tend to show that they have more experience and good coping skills for handling stress within their environments. The goal in studying overtraining and burnout is to learn how to develop programs and strategies that help sport personnel prevent these conditions. Start by monitoring critical states in athletes. Coaches, as well as athletes themselves, must monitor such states so that athletes in the early stages of overtraining and burnout can be identified and helped. Communicating within social support networks should also be developed so that they can be tapped when necessary. Self-awareness and preparation early on might prevent burnout later. Setting short-term goals with incentives for reaching them not only provides feedback that the athlete is on the right course, but also enhances long-term motivation. So in summary, some strategies have been developed to help prevent or reduce the probability of burnout in sport and exercise settings, and they include setting short-term goals for practices and competitions, taking relaxation breaks, keeping a positive outlook, and learning self-regulation skills.